This video is part 6 in our educational series on how to utilize a conservative treatment approach by treating soft tissue restrictions for a client who has degenerative disc disease of the cervical spine. In the video, I cover the following: the importance of continued client communication and education on the treatment process, how to get the client to fully participate and comply between visits and at home, corrective exercises, and postural retraining examples I use for my clients. For those of you who don't know me, my name is Dr. 𝘳𝘵-𝘵𝘀𝘍, and I am a soft tissue injury treatment expert specifically for chronic neck, upper back, shoulder, and arm pain. My focus is on finding and fixing nerves that get stuck to muscles with a glue-like substance called adhesion, also known as scar tissue, and then reducing inflammation from chronic pain without the use of drugs, injections, or surgeries. This leads to a significant increase in overall functioning, flexibility, and long-lasting pain relief. I'm also the creator of the PEAK method, where we teach overworked manual therapists a new injury treatment system that eliminates the frustration of not getting consistent results, allowing them to reduce their treatment times by at least 50% and easily double their income. All right, let's get right into the video. If you haven't watched any of the other videos in the series, I'll link it up top here if you're watching on YouTube. If you're watching it anywhere else, it'll be down in the description box below. But non-surgical soft tissue treatment for degenerative disc disease, part 6, load management, corrective exercises to really help them maintain progress and slow down the progression of the degeneration. So one thing I talk about a lot is the importance of continued client communication and education on the treatment process. We make a lot of mistakes, and I did a lot of times over the years with our clients of thinking it's just about the treatment, what we do, but really having the client understand what they need to do in between visits, what they need to do in between treatments, and really assuring that they're doing their part at home. You know, a lot of clients come in and they just want you to treat them, and then they don't want to do anything to help, and then they start to complain that they're not getting any better. They don't really want to be active in the process. They just come in and say, here's my problem. I started, you fix it. It's like, no, I'm here to help, but I'm not going to do all the work. This is going to be a team effort as we go. One thing that you have to get across to the client is this idea called load versus capacity. So any injury in the most simple framework is where load exceeds capacity. So I always think, and I say, think of it like a teeter-totter. And on one side is load, which is everything they do. And the other side is capacity, is what their muscles and their joints and their ligaments and their discs and all the structures can take. When load exceeds capacity, that's where an injury happens. This is why I kind of really like to work more in like non-direct injury type of thing, where it's kind of like a compensation or a biomechanical thing, where load is just slightly more than capacity, and that's where the injury occurred. So what I'm always trying to explain to the client is, by us getting in there, removing the soft tissue restrictions, getting function back, getting rid of the nerve entrapments, getting all that bad stuff out of there, all the adhesion, we're increasing their capacity so they can do more load. But in the meantime, they really still need to keep their load at a minimal spot so we can allow that to continue to get better. Because a lot of times what happens is the client feels better, so they think they can do a lot more, and then you're right back to kind of right where you started. I always give this analogy too. I'm a big analogy person. I think sometimes as musculoskeletal providers, we kind of like talk too fancy to the clients, and we say all these fancy terms and anatomy and all sorts of stuff. We'll even bust out the anatomy book and show them, like, they'll be like, oh, that's cool there, but they're not really listening. So I give them a diabetes analogy. I say, basically what's happening here in the office is I'm treating you for diabetes, and you're doing really good, but then you go right out to the car and you drink a 42-ounce big gulp full of sugar. It doesn't get any better. That's what I tell them. If you're like doing a bunch of dumb things in between with your load and I'm fixing your capacity, it's never going to get better, and we're going to continue to just spin and spin and spin. But eventually we're going to run out to that point where that degeneration is going to be so bad that there's nothing we can do from a soft tissue component to actually help this. So they do have a window where we can get in there, but it doesn't last forever. Next is, and I know this one's hard, is getting them to stop with other providers that are making the problem worse. I always give the analogy too of like too many chefs in the kitchen. So I've had clients that come in and like they're seeing like a chiropractor, they're seeing a massage therapist, and maybe they're seeing an acupuncturist and then a personal trainer, and everyone thinks they know what they're doing, and they're just doing more and more treatment and loading it up. No one really knows what's happening. And a lot of times you don't want to like step on toes and be like, oh, don't go see that. But if the treatment isn't helping, they don't need to. So one thing that I do when they do come to me and they've been dealing with chronic problems, I'm like, I'm the only one you're going to see right now. I'm in control of this process. And then we can gradually get back to that stuff if we need to. But more than likely, you're not going to need to, because my question back to them is like, if all those other treatments are helping, why are you here and why are you still in pain? Yeah, think about that. Next is being very clear about what they can do. That's a big thing. A lot of times we always say, oh, don't do this, don't do that. Oh, and then they're like, they come in, they're like, oh, I pushed it. You said you could not to do this, but I modified it from there. My thing is like, I just give them a list. This is all you can do. In the beginning, I'm like, hey, you can just walk, or you can just do body weight. You can do stuff like that. Be very, very clear. And then I also say to them, if you think you want to do something, what I need you to do first is message me, email me, text me, and say, hey, I want to do this. And then I'm going to let you know if you can do it, or I'm going to tell you some type of modification. Because a lot of times they always say it's a lot easier to ask for forgiveness than permission, but not when it comes to an injury. We want to ask for permission first, because a lot of times if they screw it up, we're going to be right back to where we started. So how to get the client to fully participate and comply with at-home recommendations. This is a big problem. You're always like, oh, the client doesn't want to do the homework. They don't want to participate. And then they don't do better. They blame you. And then you get mad at the client. And then it's just not good for anybody. So what I do in my clinic is, I've talked about this a lot, is I sell them the whole treatment process up front. It gets them committed to the process. It helps me focus and dial in and really know that I'm doing what's best for the client per visit. I'm not trying to do too much to hit a home run and hoping that they like magically feel better in one visit. And if they don't come back. I have them come back. They're there, but I have them sign a code of conduct. And basically what I do is I do guarantee my treatments, and they're going to get results as long as they follow the code of conduct. So they got to like show up for the appointments. They got to be on time. They can't cancel last minute. They can't do a bunch of dumb stuff we didn't talk about. They can't treat with other providers. So I operate on a 3-strike rule. If you get 3 of those strikes throughout that, then the guarantee is void and I get to keep all your money. It just really lets them know that we're serious about getting them better, and we want to help them and see this in the best way possible and see it all the way through. Because at the end of the day, most people just aren't held accountable by providers, because, as a provider, you want to be nice to them. You want to be their friend, but I don't want you to be their friend. I want you to be the one that tells them what they need to do and how to get this better, because you're a true problem solver. Next thing I do is I do this thing called the postural transformation program. I'm going to go more in depth on the next slide about that. But it really helps them participate and stay accountable. It's like things they can do from home. I'll go through all that on the next slide, but that's really helped as well. And I gave it like a fancy name, like postural transformation program. They're like, oh, this is cool. And then it makes them feel like they are participating, because I do need them to participate, because they're only seeing me for, a short amount of time for the treatment. All the other stuff they do at home, this is going to help them manage that load as we continue to get that capacity better. Next is just be definitive with the rescheduling process and be the leader for the client. A lot of times we're like, oh, just give me a call back when it gets bad. No, don't do that. Be definitive in what you do. Always have a plan. I'm big on maintenance. I'm big on continuing care and stuff like this. I think getting your muscles clean and keeping them functioning is just as important as going to the dentist and getting a cleaning. It should be like this as well. So don't be wishy-washy and don't say, hey, when do you want to come in? Or just call me when you like, get them on the schedule, make sure they're there. I never let anyone go more than about 4 to 6 weeks in between treatment. If they don't want to do that, then I actually discharge them from care and then just help somebody else. Next is corrective exercises and postural retraining, and some examples I use from my clients. Now, I've talked about this before. You do not want to there's an order of operations to fix a problem. You need to restore range of motion first. So you don't want to get into the corrective exercises until all the tissue is healthy. It'd be like trying to fix a cavity by brushing and flossing it before you actually get the cavity. So we're like, as the soft tissue providers, we're like the dentist. We're going to go and drill it out. Then the corrective is going to be like brushing and flossing and keeping it good. So one thing I do is I call it like a postural transformation program. It's just really making the client become what I call a human, being a normal human. We show them proper hydration, proper breathing, proper position with sitting with their phone, load management things like lay downs, ice, relaxation. And then we even get into some breathing patterns. It really helps to limit what I call the inflammation in between, and also just allows that tissue to accommodate too. Because when we're treating all the tissue, they are going to start functioning better, but it takes some time for that tissue to come back and get better. So this helps them mitigate some of that load factor as we go, and it makes them feel like they're really part of the process, because they need to be. Next, I talk to them about their workplace setup. I say, hey, tell me about your workplace. Like, what's it look like? I have them show me pictures of their desk, maybe get them in a stand-up desk, help them with posture and stuff like that. Those little things kind of go a long way in managing the load. Then I do an exercise. It's called a quadruped chin retraction. It's really focused on building up the anterior portion of the neck. The neck has a core in the front, just like the lower body, and it becomes really deconditioned. It's a very focused and structured type of exercise. So what I'm going to do first on the video is I'm going to link up an educational video of one of our providers going through how to do this, and you can see how precise and focused it is, but it makes a big difference in getting that neck in a good place and getting it more stable. So I'll link that up now.
Okay, so today we're going to be going over 𝐜𝐶Rs, and that's the neck retention exercise. So what that does is it targets the core of the neck, the front side, that goes to sleep from a lot of this forward head posture. So now that you're at dysphasing care, we need to strengthen these back up. That way it takes pressure off the discs and the muscles of the back that we've cleaned up. So Andrea is going to demonstrate that exercise for us. So what we want to do first is go on all fours, shoulders over your wrists and hips over your knees. And what you're going to do is find your neutral. So it's going to be somewhere around like that. So it should be comfortable. What you're going to do first is drop that head down towards the floor in a parallel fashion. So you're still not tipped one way or the other. Then from there, you're going to tuck your chin like that. You'll feel the front side of your neck turn on. And then keep that chin tuck and come up to the top position where you're back at neutral. And you're going to hold that for 10 seconds for 10 reps. You can relax out of that. And daily. So that will really help strengthen this part of the neck, like I said. Really fires up the core of the neck and lets all that degeneration and the muscles on the backside breathe.
So just a couple things with the corrective video. Be slow with it, be deliberate, make sure they have it, make sure they see it. And even get them on the phone doing that so they can see it as well, because it really is important. And when people do this, it just allows that healing environment to continue to get better. Then I'll go over like sleeping pillow recommendations and keeping everything aligned. There's a couple pillows that I really like. I like Core products, and I also like a pillow called 𝘬𝘠𝘦. Really keeps things neutral throughout the night, because like I said, our job is to really manage their load throughout the visits as they go, and we're continuing to increase their capacity. This is going to keep it from coming back and becoming a bigger problem, because the disc itself doesn't go away, but we can slow it down and give it a chance to start to heal up. That's all I got in the video. I appreciate you watching. Share any insights you might have gotten in the comment section below. I try my best to answer every single one of those. You can also do me a solid and share this with other providers that you know might help. And lastly, go download our free training modules. The link is wherever you're consuming this. We go through my full system of neck and shoulder, from evaluations to palpations to treatment to client communication. It's really, really good and really in depth. I appreciate you watching, and we'll see you on the next one. Bye.